Tired of dull nursing simulations? Well, today we're transforming clinical training with DIY escape rooms.
Why does this matter? Medical error is America's third leading cause of death, often from communication breakdowns.
In routine simulations, students kind of zone out. But escape rooms? They demand active communication and intense teamwork.
So what is it exactly? Basically, it's collaborative, puzzle-based clinical learning under a strict time limit.
You can get super creative. Imagine prioritizing care for chronically ill pirates before the tide comes in.
Or, if you prefer realism, just stick to traditional clinical settings like a mock code mystery. Okay, before starting, you absolutely must set clear ground rules for physical safety and mutual respect.
Designing your own is simple. First, form a small team, pick a theme, and set learning objectives.
Next, structure your puzzles and do dry runs. This ensures everything works smoothly and avoids student frustration.
The best part? No massive budget needed. Everyday items and patient charts make perfect, cost-effective clues.
Seriously though, never skip the dry run. Testing ensures your puzzles remain challenging, but never discouraging. The payoff? Research shows these rooms significantly enhance knowledge retention and build vital camaraderie among students.
So, are you ready to ditch the routine and finally unlock your students' full potential?